So we're talking now with Pascal Derrien, the CEO of Migraine Ireland, and we're very pleased to have him here with us. You're very welcome to the show.
Thanks for having me, guys. I'm delighted to be back.
Always a pleasure. So you might tell us, first of all, about migraine, the basics of migraine and how it affects a person.
So migraine, so first and foremost, what is important to know is not just a headache, it's actually a complex neurological disorder. The research is hit and miss, so we actually don't really know what is the root cause. However, research suggests has to do something with brain waves and alpha brain. Now, migraine, I should say almost migraines, there's multiple types of migraines. There's probably 7 or 8 types of migraines: abdominal, hemiplegic, which is very rare but very disabling, migraine with aura, migraine without aura, and so on and so on. So it's a multi-layered condition. Also, it's a multifaceted in terms of symptoms. So it's highly individualized. So you may experience some symptoms, and another migrainer you may come across may experience other symptoms. And if you add comorbid to the mix, you have a condition which is actually relatively complex and complicated, both in terms of treatment and also in terms of diagnosis.
If anybody wants to know about that, your website is absolutely chock-a-block with information about all the different types. If you're diagnosed newly with that, go on the website. I can vouch for it because I've read through all of it. Is migraine more common in men or women?
Well, so men 30%, ladies 70%. They hold the flame because there's also an hormonal component to it. Children as well, small section because migraine is almost hereditary to a certain degree. Also, from an age bracket perspective, it tends to impact the ladies in their prime, from early teenagers to 50 plus. However, a lot of people do carry the flame of migraine beyond those years as well. The WHO does reckon migraine is the 5th most disabling worldwide neurological condition, and for ladies, it's actually the 1st.
Is there a reason why it's more prevalent in women?
Hormonal, primarily, and I'll leave it at that.
Okay.
So there's this idea that it's just question of headaches, obviously it's much more complex than that. Yeah.
Absolutely, there's a form of trivialization around migraine, the standard headache, and that's the tip of the iceberg. However, as I keep saying, and I'm often being quoted, perception is not reality. You have multiple layers. Allow me to be graphic for a second, but vomiting, dizziness, visual disturbance, symptoms may last from a couple of hours to 3 or 4 days, depending on the type of migraine you may have. In terms of, you have the recovery aspect, but also the leading up to. So just to give you some stats, today there will be around 13,000 to 15,000 attacks of migraine in Ireland. So same tomorrow, same yesterday, same the day before. Yeah. On any given week, there will be around 100,000.
Wow.
Which does lead to some significant economic impact. So there's millions of days lost to productivity due to migraine because the migraine population, by and large, is still part of the workforce. And the impact on the Irish economy, we estimate it's around 260 million euros per year, roughly. So pretty significant impact.
That's serious, and very debilitating.
Completely.
Yeah.
And can they take place very suddenly? Is there usually some kind of warning, or can it just strike?
So when I was telling you about the multi-layered aspect of migraine, there's also complicated factors. It depends on if you are a chronic migrainer or if you're an episodic migrainer. And depending on the type of migraine, so migraine can stay at bay for years for some individual, but for some other individual, you may have 3 or 4 attacks per month, depending on the type of migraine you may have. The triggers, yes, there's triggers. Actually, I should talk about threshold. So there's normal triggers such as alcohol, sleep, diet, a lot of things which are actually pretty common to other chronic conditions. But what we reckon, for example, if we take the example of alcohol, that glass of red wine you may have in the evening today may just be the tipping point. Yeah. You may have the same yesterday, and it may not bring you over the edge.
Okay.
So it's really around threshold. So which is really important for migraineurs to really understand their patterns. So we really often advise to get a diary, try to understand your own patterns and take, I suppose, control and understand yourself, either paper-based or we do digital, which are, we have migraineinsight.ie, migraineinsight.com, which is a company we're working with, which is in the US and do brilliant digital e-diary. So it's really important. So again, the triggers and the threshold may vary from one individual to another. Hence the difficulty to pinpoint. You cannot really have a blanket approach to migraine in terms of actually prevention or even treatment. And that makes things difficult because you cannot be binary about all those things. It's not like other chronic conditions whereby if I take type 2 diabetes, for example, you have some biomarkers, and by and large, if you have type 2 at 80%, 90%, the treatment may work. It's a blanket approach to a certain degree. It's been proven to a certain degree. In migraine, it's a different story. You may try something, it may not work, they put you on something else. Okay. So it's really, really a long journey. And actually, it takes roughly 6 to 7 years to be properly diagnosed in Ireland. Now, there's some external factors why.
When you say it's more prevalent in women, what about women? How does migraine affect women with contraception, pregnancy, and so on?
So it could be an event. So that's one thing. Migraine pregnancy, I'm not a clinician, so I'm going to reserve the right to skip that one.
Okay.
However, what we hear is it could be life events, it could be hereditary, it's hormonal again, and it can be also triggered by other conditions. So sometimes migraine is only a secondary. So you may have epilepsy, you may have an acquired brain injury, and so on and so on. So you could be visually impaired. So there's quite a lot of things going on there. And because of the lack of research to a certain degree on migraine, we don't know so much. So don't get me wrong, there's been a lot of development around acute and preventive treatments, even some alternative treatments, but a big caveat there, a big warning on my side. Okay. But from a pure R&D, cure-wise, no. Partially because while migraine is highly disabling, it's not life-threatening per se.
Yeah. I was surprised to see that migraine is a risk factor for stroke.
Yes. So
is that in all cases?
No. And that I want to reassure the people who are listening today.
That's important.
Don't go and overanalyze things. It could be, in a case of some migraine, especially hemiplegic, that you may have some strokes-like type of symptoms. However, they are very rare. What we know as well, it's in the case of migraine in people who smoke. Again, there's some clinical evidence, but it's very, very small. In any case, go and talk to a GP.
Yeah.
That's the thing. If you have any, because it could be a manifestation of something else. It may not be migraine. It could be cholesterol. So I go back to this multitude of factors where migraine may not be the denominator in terms of, symptoms as well. So if you have high blood pressure and so on. So if you have high blood pressure and migraine, it's probably not necessarily because of migraine. While it could be a contributor. It could be. So again, I'm not a clinician, so don't go and quote me. But what I could tell you is, yes, it's a risk. It's minimal. So I don't want to send people in panic
Yeah.
on the airwaves. However, any concern, GP, or nurses, or even A&E if it's really acute. Don't go and try Dr. Google. Even in any case, just call our info line as well. Our nurse will direct you. And I can tell you, she would probably tell you the same than me. Just go and talk to your GP.
Very good.
So
Tell me. Go ahead, sorry.
So diet and exercise, can they play a part in living with the condition, improving it? Yeah.
Completely.
Yeah.
However, in the case of migraine, exercise can be a double-edged sword. So if you take running, if you go and do 3 or 4 or 5K running, that may be okay.
Yeah.
If you go and do a marathon, they may actually trigger.
It may cause it, yes.
So again, it's trial and error because it's so individualized and there's also a component to it. Yes, so diet and exercise is good by and large. That's the overarching principle for any type of chronic condition. However, in the case of migraine, don't overdo it. Try to understand what works for you. Also, I think low impact may be a bit better.
Yeah.
So walk, all these type of things. Playing squash and badminton, which is high intensity with a high level of adrenaline, maybe, but maybe not.
Yeah.
So again, it's use your own judgment. And that's the case for migraine on a multiple aspect of the condition is it's so individualized. I cannot really give you. So yes, your healthcare practitioner will encourage you to do some exercise, but I think you need to do the exercise which is for you. So yoga, Pilates, and so on. Physiotherapists will encourage you to do that. And actually, we have been running a couple of webinars on yoga. Now, I fully understand yoga is not for everybody, me included. But, I have to recognize the benefit for some chronic conditions.
Of course. What's the treatment? Is it always pain medication? So
there's acute and preventive. Again, depending on the type of migraine, and we don't have time today, but I suppose there's what you need to know to the acute, preventive, and alternative. And I labor the point a bit on alternative because it's important that I put a big caveat there. So at GP level, the entry point is painkillers and all these type of things. That's the standard cliche around migraine. Yes, it does address for a cohort. However, if you are a chronic migrainer, or if you have a heavy type of migraine, you can move into a type of products which are what called high technology. It could be anything from beta blockers, anti-CGRPs, injection, medically supervised, obviously. Combinations of medications as well. And I'm not going to give you any names because we don't endorse products.
Okay.
But yes, so there's a cohort there around acute and preventive. The last few years, there's been massive developments from 3 or 4 companies around preventive treatments, and they've been on the market for, I suppose, a year or 2 for some of them. Now, the cost is still prohibitive because few of them are not under the DPS scheme. However, I hope that they're going to move. So some other products they move into generic, a bit more affordable, but they may not work for some individual.
Okay.
Now, the alternative treatment. When I do talks, especially in the workplace, for example, we talk about alternative treatment. It comes with a big warning.
Of course.
On my part. It's the wild, wild west. Snake oil merchants all around. There's a lot of stuff out there online preying on vulnerability of people. The level of health literacy does vary from one individual to another. And if you're really in pain, you're almost willing to try anything. Now, you have some standard stuff. We talk about acupuncture, all these type of things. May work for some individual, may not. But if supplements, yes. But what? To what degree? Even if there's clinical evidence and so on. So Migraine Ireland, our position is we never ever endorse any product unless it's medically supervised or under a prescription scheme.
Gotcha.
That's one thing. Now, that said, stuff may work for some individuals. I'm not denying it. However, well, us as an organization, we're too small to validate it. But, clinical evidence, which are not European, are to take with a pinch of salt. A lot of organizations there are more interested by profits than trying to help the patients. And I say that very bluntly because that's actually the case. And not only for migraine, by the way. So I would say the port of call is really, in any doubt, is to go back to an HCP, which is an healthcare practitioner. Being a nurse, being a GP or a neurologist, don't go on any type of site and try to self-medicate. Now, I will just finish on that. We know migraineurs are targeted online. Some people are crazy selling you mushrooms, stuff, There's a lot of crazy stuff out there because it's highly engineered, and especially the last 18 months, there's a lot of chatbot activity.
Of course.
So please, please, please don't be naive and go and see a doctor. I know it's 40 euros or if you have a medical card or whatever, but please don't go and self-medicate because you actually don't know what you're taking and what impact it may have or may not have. In many cases, it's harmless, except to your wallet.
Yeah.
But, who knows what it may trigger.
And as usual, if you're taking medication, stick to the recommended dose.
Completely. Actually, very valid point. Medication overuse, headache, and medication overuse, full stop. So medication overuse, headache, is in migraine specifically, we know that on the lower end of the spectrum of people who tends to self-medicate, or if you want to take paracetamol, it could be the vicious circle. If you take too much medication, actually you may just have a small relief in terms of time, bracket, but it may actually tip you over a vicious circle when you have medication overuse headache. Also, medication overuse full stop.
Yeah.
To your point, stick to the script. Yeah. You're not a pharmacist. Well, unless you are, and you probably not do it, but really, it's really important. You will not see anybody with any other chronic condition overindulging. They are not candies. And more is probably not good. Less is more in a case of, I suppose, any type of pathology. So in any doubt, GP, pharmacist is a very good point. The pharmacists in Ireland actually are absolutely brilliant at giving advice. So whatever is written on your tablets, or especially if it's prescribed, absolutely important. If you take OTC, it's really important to read what's in it. So, don't take ibuprofen 5 times a day. You need to mix, paracetamol and ibuprofen. Standard things, but really, with no pun intended, use your brain. It's really important to stick to it because medication overuse is a big problem.
Yeah. It's a major problem here in Ireland.
Absolutely.
So tell us about Migraine Ireland. When did that come about and how?
So Migraine Ireland, actually, would you believe, 3 years and a half in a role. However, Migraine Ireland is 30 years old this year. And it came about by the need to address trivialization, stigma. There was no organization in the country where you could go to for information, signposting, and so on. So at the very beginning, it was standard information. And over the years, we have evolved to advocacy, education, and actually service delivery. So we actually use Section 39. And we provide some services specifically around psychology support. Right. We work with Bowman Psychology, for example. When they are running a compassion-focused therapy session, we take cohort of 10 to 12 people. with a psychologist in Beaumont for a period of 8 weeks, and it's really around, addressing all the other aspect of a chronic condition. So chronic condition, you have your pathology, your symptoms, and so on, but you have something which is actually common to all chronic conditions, which is the mental health impact of carrying a chronic condition. So anxiety, fear, all these type of things, and which obviously are not treated by medicine or tablets. So, well, to a certain degree. So we have that in place, and we have afternoon tea, which is a kind of a digital working clinics, people talking to each other. We have our own self-management care course, which actually we're about to relaunch. We also have a peer-to-peer platform. It's just migraineurs talking to migraineurs, which is a closed platform, which is only for our own members. So that's roughly what we do. In terms of education, we provide workplace talks. And really, it's really providing a migraine 101 to people who may not be familiar with migraine. And again, like I said earlier, a lot of people are still working who are migraineurs. And we do a general public talk, so maybe 1 or 2 a month, and really they're free of charge and they're open to everybody. And then we do multiple campaigns. We're pretty active on social media, as you guys know. And it can be anything from In Their Own Words campaign, which was a patient story, so in their own words, really, 4 or 5 videos. And actually, we are entering the Irish Healthcare Awards for it, so we're pretty pleased with that. But so much, actually, because it does help us to, I suppose, showcase is not the right word, but show that actually migraine is actually far more than just a headache. And actually, the ladies, in that case, who accepted to provide their testimony, it's really powerful. So it's really our role to, obviously, we provide service to the migraine community, and you're almost preaching for converted. What we're trying to do is to reach out to the rest of the population, where, try to equip them with a basic understanding of migraines, because the next time they come across a migrainer, they may not be dismissive or discard the condition altogether, and they may have a basic understanding of the social burden or the professional burden.
I can certainly recommend that anybody with a migraine who doesn't know anything about it, definitely go on the website, because there's a huge amount of very, very, very interesting information. Anything new?
Yes, so I was mentioning, so there's twofold. So we're going to have a new website. You're talking about the website. Actually, we're going to have a new website, hopefully by the end of the year. On our website, my current website, served us well, but what got you here will not get us there. So we are rebranding, refreshing, and make sure that the information is really available to people who may be either newly diagnosed or want to know more about migraine. And there's twofold. All our information will be completely rejigged in terms of how you get access to it in a very, very dynamic way. But also, we're going to introduce 2 major changes. One is an AI support. So we have an info line with a nurse behind it, or a patient team. But obviously, they work part-time and they're not always available. With the AI support, what we want is to have a 24/7 type of access for what I call tier 1 queries, or tier 2 to a certain degree. We're not going to provide you any clinical advice. That's not what we do. Actually, none of us will do it. However, we're going to provide some signposting. It could be anything from who's the nearest neurologist in my area to I have X and Y. I know what can I do, or can I know more about hemiplegic migraine, and so on. So provide you a bit of, I suppose, some directions as well, and pointers. The other aspect as well is we want to be stronger in education for the HCP community, which is healthcare practitioner. There will be a lot of videos we have done where we're accessible there for the healthcare practitioners as well, not only the general public. And we are going to focus on as well migraine in children, and we're going to have a gamification aspect to our and quiz and so on for the children as well. So we are completely, well, our website served us well, but as opposed to build on it, we're deciding to take it down at some point and rebuild from scratch and really respond to the need around, how people consume information as well. So we really think about the website as a kind of a download station or station, not in a very dynamic and organic way, as opposed to a lot of people think about their website in a static way. So based on what we hear, I think it's going to be pretty innovative in a sector.
Sounds like it.
The preview I've seen, and it takes a lot to impress me, I've been blown away. Obviously, I'm biased. But if we manage to deliver the vision we had, I think that's going to be a plus for the migrant community and non-migranters as well.
So tell me this, if there's somebody out there now listening, how would they get in touch to access all this fabulous information?
So migraine.ie, as simple as that. So that's the website. If you want to know more, info@migraine.ie, which is a mail. Now, obviously, I always forget the info line number, but we have a nurse, and actually it's on a website. And we're on, obviously, social media all around, so we're pretty active. Contact me on LinkedIn. I'll get back to you. If I don't know the answer, I will find somebody who actually will know the answer for you. Our Facebook page is pretty active. We are on all of them. So communications-wise, we are there on a daily basis. We provide a lot of information, tips, updates about the organizations or updates worldwide. While actually we are obviously an Irish non-for-profit organization.
Yes.
And the Republic of Ireland, not Northern Ireland, is my jurisdiction. We work a lot and exchange a lot at European level, international level as well. Right. So we're not very insular in that way. So the interesting bit on that is that the commonality, all the sister organizations, we tend to experience the same, because while migraine in Ireland is pretty prevalent, let's say 10 to 12% of 600,000 people roughly estimated, there's a universality almost worldwide, with various degree of complexity, depending on the health system you are part of. However, they all share the lens in terms of diagnosis, the multi-layered aspect, the multifaceted symptoms, and all these type of things.
So will the AI help keep the information refreshed the whole time?
Completely.
Yeah,
and acquire knowledge as well. So now we have to put the right parameters in place, because you almost move into the medical space to a certain degree. So we have a strong medical editorial panel as well. We have nursing policies and all this type of things. So we will never ever go beyond our brief. So we're going to start in a very humble way, and then we'll build on that. But it's really, for me, it's kind of having this 24/7 type of availability to a certain degree. And, I think the time when you have people manning InfoLine 24/7, personally, I think those days are gone. Now, financially, it's not feasible. You cannot run in with volunteers either, except, if you're in PETA or maybe you're aware, all these type of things. But for us, we are way too small. So we had to come up with something innovative and creative whereby, it's 11 o'clock in the evening and you have a question, and obviously while we do long hours, or I'm not working at 11 o'clock in the evening, so that you would have at least maybe the beginning of an answer, and it could be followed up by a call the day after, or dropping a mail to InfoLine, and we will get back to you within 2-3 days. So I think this immediacy of information just to reassure, and I think sometimes, obviously it's going to be artificial, having a beginning of an answer may help people to alleviate their anxiety as well.
Pascal, thank you so much for coming in.
Oh, you're more than welcome. Always a pleasure to come to you guys.